Please join me for the pledge and pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Dear Heavenly Father, we ask that you watch over these proceedings today and give us the wisdom that we need to do our work for Fremont County and the people of Fremont County. We ask that you please watch over those traveling home from the 4th of July weekend. Keep them safe and from harm's way. We ask that you please watch over our military home and abroad. Keep them safe and keep our first responders safe. In Jesus' holy name, amen.
Amen.
Okay, this.
issues.
Good for approval.
Second. Been moved and seconded. Further discussion. All those in favor?
Aye.
Minutes.
Motion to approve the minutes.
Been moved and seconded. Further discussion. All those in favor?
Aye.
Opposed? Motion passed. We have some bills that need to be paid.
Mr. Chairman, I move for acceptance of bills.
Second.
Been moved and seconded. Further discussion. All those in favor?
Aye.
Opposed? Motion passed. We have no Title 25 signature file.
Chairman, you have, preparation of publication and then statements so in that, move to approve the request for a statement of county's receipts and expenditures from July 1st, 2025 through June 30th, 2026, in accordance with the Wyoming statute 18-3-515, preparation and publication of annual statements from the county treasurer, county clerk, to be presented to the board and related in September 30th, 2026. Okay.
It's been moved and seconded. Further discussion. All those in favor?
Aye.
Opposed? Motion passed.
Move to what you want to do this, you want me to do the, agreement between the governing bodies for the, 3/4%.
We can do that. Yeah, we can.
Do that now?
Yep.
Okay. Move to approve the MOU between the governing bodies of Fremont County setting the provisions of the 3.4% tax, if passed on the primary ballot on August 18th, 2026.
Been moved and seconded. Further discussion. I do have one thing to add. If this board recalls, we approved the MOA on 3/4% sales tax.
Mhm.
And one of the requirements in that MOA was that if there were any changes, it would have to be unanimous changes.
Mhm.
So Lander reviewed it and they made one small change that it would be audited and reported annually on. And that's the only change that they added. And we just need to recognize that change. And if we agree to it, then we'll vote on it and go from there.
Mr. Chairman,
Yeah.
what does audited mean?
Uh,
Like who's doing that?
I don't think that's been defined. Who?
So is it still that the 30-day, that's the county clerk, since I recommended that, apparently it's going to come to me. I'm supposed to be in charge of making sure that happens, or is that still in there? And if so, I do need to know what audit means.
It would be number 8, line item I. And I think Kyle Butterfield's on, if he has anything to add. He's not on.
it says, audit access to records, parties of the MOA shall have access to any books, documents, papers, records, of projects which are pertinent to the MOA. The parties of the MOA shall immediately upon receiving written instruction from the other, provide any party or independent auditor, accountant, or accounting firm, all books, documents, papers, records of the project which are pertinent to this MOA annually. Service providers for emergency medical services, commercial air, ground traffic shall report to the parties during a public meeting.
So, I mean, a regular auditor that does all of our work is going to, that's public information.
Right.
So a public request, just FYI. So it sounds like each entity that's getting money would have to, that they're saying that they would want them to
It's,
have those available for review by anybody who asks, which, just so you know, that would have to be anyway.
yeah,
Okay,
it's just.
okay,
that
just
was-
so I'm not the one gathering it or
Right.
whoever's in this position, this is just happening.
I think each independent,
So like the ambulance would be,
Yeah.
if that's where
Right.
it stays, and the airport would be with
River.
City of Riverton, and WRT would be with FK or
Yeah.
wherever that's.
That's the way I understand. it.
Okay, just clarifying before we.
I don't think it says, the clerk's office will.
Okay.
Or
You're
the
responsible.
treasurer's office will
Right,
prepare an audit and report on that annually.
all right, perfect, thank you.
Any further discussion? All those in favor?
Aye.
Opposed? Motion passed.
Move to accept the bid from PCI in the amount of $20,579 for network infrastructure to come out of the IT budget.
Second.
Been moved and seconded to approve the contract with TCI. Further discussion? All those in favor?
Uh,
Opposed? Motion passed.
Chairman, the rest of these are all noted for time
Okay,
and then, record of proceed.
all right, if you'll just hold those, priority mail.
Mr. Chairman, first we have, a 24-hour malt beverage permit. Metal Rock Market and Kitchen DBA Slow Food Wind River to farm to table event at the Alpine Science Institute on September 19th, 2026. Move for approval.
Been moved and seconded. Further discussion? All those in favor?
Aye.
Opposed? Motion passed.
The second one is number 2, death benefit threefold. I need a, motion to approve the Fremont County death benefit for 2026-2027, which provides the beneficiary a full-time employee a total sum of $10,000 within 120 days after the death of the employee, and $5,000 prorated to the benefit of the part-time employee, funded through the health benefit fund. And for approval.
Been moved and seconded. Further discussion? All those in favor?
Aye.
Opposed? Motion passed.
Next one, Mr. Chairman, is server updated TCI Justin Horner.
Wrote a
Letter here. Brief server update. New email server is online and currently serving mail. We have prioritized access for a limited set of individuals who should now be able to reach their accounts while data recovery process remains slow. We are moving forward and expect historic emails to be restored within the next couple of days. So I guess that's a good thing, but we'll get it done here pretty quick. Okay, and then the next item is Regional Ambulance Service Evaluation Committee.
Nick, you want to come up and we could go through that just real quick? the rest of the members of this board were not in our meeting we had with the mayors last week. Do you want to go through it? Or
Sure.
you
So,
just hit the highlights, I guess?
yes, so Mr. Chairman, members of the commission, thank you for the opportunity. Earlier, late last month, we made our final report to the Fremont County Association of Governments with a recommendation. Ultimately, this recommendation came down to a kind of a force laydown and then a financial projection. So we built, and like, it took us 6 months to do it, but ultimately, in kind of working through a whole lot of data, and then ultimately some bottom line, we looked at a lot of stuff and came up with a recommendation. So in your packet, this is our current service layout. And what you're looking at here is call volume. And then
Yes.
on the legend on the right is kind of percentages for 2025. So looking at how we are allocated currently with ambulance in Du Bois, 2 in Lander, 2 in Riverton. You can kind of see that we're drifting. We are covering a good chunk of the call volume, but not enough of the call volume relatively. So one of the things that we looked and modeled was revenues as well as, best fit. And what we ultimately came up with are 2 models, which are kind of time lapsed. So model 2A is where we would like to be in the near future.
Okay.
What that would be, and I apologize, it's cut off just a little bit, but ultimately, 2 ambulances in Riverton, 1 ambulance in Lander, 1 ambulance in the Fort Washakie-Effingham area, and 1 ambulance in Du Bois, with an additional 2 ambulances that are for inter-hospital transfer. One of the things that we identified across the last 6 months is one of the reasons we are sending so many people via air is because there's not enough ambulance availability. It's a combination of crew issues and then time of availability. So that is critical to generating revenue for the ambulance service. We're leaving, for lack of a better way of saying it, we're leaving money on the table for our ambulance service by not having those carriers available. That's where we would like to be. What we ultimately modeled it out as, to run a system of this type, we probably need to have about $6.5 million. Was it 6.5? I apologize. Yeah. 5.8. Thank you. We were trying to figure out line of best fit, but let's call it 5.8. We figure, based on call volume in 2025 and the payer mix, that the ambulance system generates about $3.2 million, $3.3 million of revenue if we do it well.
That's without the 3/4 cent.
Correct. So there's still a gap of about 2.4, 2.3 that we need to kind of come up with. Ultimately, the 3/4 cent would cover that gap with a little bit left over. I think one of the interesting, thank you, let me give you the exact numbers. 3.49 million is what we anticipate we could generate in revenue based on payer mix and call volume. So the funding gap is about 3.18 million relatively. So total cost is 6.68 million. We think that with the sales tax, we can come up with that. And I think one of the other things that is not really pulled out of this, but is important to consider in the budget that we built, or the financial model, is every year in our model, we put about $774,830 aside in capital, $774,830 a year for equipment replacement. So that every year, more or less, we're replacing an ambulance and a half. But ultimately, where we would like to get to is this one right here, which is model 2B, trying to cover everything we can. The idea here is to maintain the permanent or the full-time ambulances that I stated earlier, but now add augmentation in Crowheart, Jeffrey City, Kinnear, and I believe Shoshone, with basically volunteer ambulance service. So the idea is now we can get hopefully close to 20-minute coverage across our entire county, or at least 99% of call volume. And like, there's always going to be one that's, out north of Lysite. There's always going to be a challenge, but If we can get 99% of our calls kind of inside of those bubbles, we're doing a pretty good job, I think. Looking at the how, so one of the things that kind of prompted the work session on last Tuesday afternoon was the opening of the Rural Transformation Healthcare grant from the Department of Health. That went live last Wednesday. We've pulled it open, and what they are trying to do is basically help get everything more efficient. So the idea is more partnerships between ambulance services, hospital services, to basically boost, basically jolt performance for the next 5 years. When you talk to the Department of Health, they are uncertain that they will, even though we've been allocated $2 billion for this endeavor, they are not certain that we will get all $2 billion just because it will cross over presidential terms. Congresses will change. So they are treating it as every year, it's manna from heaven. So don't depend on what's going to happen next. For this particular application, it looks, based on our reading, that there's only about $2 million available to our county per, relative to the 44 million that's available statewide. And that's based on the caps that they have put on what's available. So there is an easy, we still have to make an application, but there is a $1 million that's more or less available upfront for capital costs, buying ambulances and things of that nature. And then interoperable dispatch equipment is also an opportunity at about $100,000 a year. But all told, new ambulance is about $500,000 per provider. We can get some acquisition and merger costs for about $400,000 and then $100,000 on the dispatch side per provider. Right. So the trick is the per provider is the stumbling block. You're only, if you are a ground ambulance licensee at the Department of Health, you are eligible to apply for these funds. Now, Frontier is eligible to apply, but here in Fremont County, the other ambulance service that is available to make the application is Shoshone. Because of the work that they have done, and we confirmed this with the state, even though they're not explicitly listed in the grant application, we did confirm it yesterday with the Department of Health. Shoshone is eligible to make the grant request so that we don't have to necessarily go through a private contractor to receive public funds.
So we were, the licensing process is relatively quick.
Yes.
And I'm going to make those calls today to see if Fremont County can get their license back.
Understood.
And there's, after our work session last week, my understanding, and I think Commissioner Jones's understanding, was that once we get the license, we will apply for the grant through the county.
Okay.
Since we currently own the assets.
Understood.
And then we'll go joint powers.
Yes, sir.
So if you'll touch on that.
So that's the other component to this application is they very much want you to work together. Tomorrow, it is a requirement. So tomorrow, one of the things that we will do from a Fremont County Association of Governments RASIC capacity is we are on the agenda tomorrow at 2 p.m. at the 1 p.m. Thank you, 1 p.m. at the Intertribal Intertribal Council in Fort Washington. What we are going to ask for is indication of support, likely in a resolution, to partner with FCAG and the county to move ambulance service forward. We're going to need their help in a lot of different ways, but one of the biggest ones is obviously citing an ambulance in the Fort Washington area. We don't anticipate a lot of contingencies haven't been settled yet. If the 3/4 cent passes, we can certainly, that's monies that we need to kind of figure out. But if that doesn't pass, we're going to have to figure out how to finance this thing one way or the other to the tune of about 3.2 million. we'll stick with it from a RASIC standpoint. And what we will do is generate that application so that we do, whoever is the submitting entity can pass it along. We are open to do it, or if you would prefer to have FTAG be the submitter of that, I'm more than happy to go in whatever direction the you feel is suitable. But
So
just as a reminder, that application is due by August 2nd.
So, yeah, so the application is only open from July 1st to August 2nd. And they really haven't sent the parameters of the grant, which, I mean, there's really no strict definitions, but if the grant review period is, I believe Mike said it was, Commissioner Jones said it was the 11th of August. And if we're approved, they'll distribute the money immediately. I mean, by October 1st.
I think they have to get it out the door before the end of the federal fiscal year.
Yeah. So all this stuff is,
Together quick.
it has to come together quick. So in our work session, I did tell all the members that were here, all the mayors that were here, I said, if I'm not a huge Joint Powers Board fan, but in this case, I think it'll work well for us, and we have some help. I think, we have a commitment from Cody Regional Ambulance Service to help us guide us through our stumbling blocks, and they realize the short time frame as well. But the first year we may be eligible, like Nick says, for $1 million. After that, we could be eligible for $4 to $5 or $6 million annually.
Okay.
But we don't know that. I mean, it's a grant.
And just to clarify, Mr. Chairman, if we apply, it's likely we will get $1 million for equipment and that type of thing. But there's a second $1 million that's available to us based on what they call a deliverable incentive payment. And the idea behind it is we don't want your service to contract.
Right.
We want it to expand or at least stay the same. But the things that they are looking for is provide 24/7 regionalized EMS capability defined by ground ambulance service within 35 miles, maintain EMS response time below specified benchmark, which they are citing as less than 30 minutes in all frontier service areas, provide community EMS services to non-Medicaid eligibles. And if we are able to accomplish those objectives, we are eligible, assumably, for an additional $1 million on top of the $1 million that we would apply for at this moment. So the hard part there is I don't know if that $1 million is supposed to come out in this fiscal year, or if what they're actually looking for, or if that's a trust us kind of
Just
situation.
in my conversations with people that it will come out in this grant cycle.
Mhm.
And then once we prove our effectiveness, if I just put it, make sure that it's going to work and we have a system and a plan in place, then we can apply there again after October 1st for the next fiscal year. And we could be eligible for, like I said, for a larger amount. But part of this is that, and getting back to what I said about Joint Powers Board, was that I'm behind this 100%, but the other parties of the Joint Powers Board have to be financially and fiscally responsible too. It can't be just the county being, as it historically has been, providing ambulance service. It's got every municipality has to be physically responsible to make sure this works. This,
Skin in the game.
yeah.
Mr. Chairman, how do you go about doing that? How will it be divided according to population? Will the city come along with it? say, okay, we're gonna set aside X amount of dollars for this.
That's the difficult part right now, because we have a ballot question in 45 days roughly that will help us understand, like, where would these funds hypothetically come from? At that work session, Mayor Pat from Du Bois indicated that her intention was maybe not necessarily to sign the MOA, but instead sign basically a declaration or resolution of some sort wherein all of Du Bois's funds would go to the ambulance service. Shoshone has indicated that they might consider a hybrid approach as well to something like that. So wherein they wouldn't necessarily sign the MOA relative to what you just signed, they would sign something that basically just directed all of their funds towards ambulance. That's one part, but if the ballot measure failed, that is a more touchy question, and I don't know, I don't know yet on that one, on how we come up with 3.2 million across the 7 different entities. So, I will stick with it. I promise you, I will give you my commitment that I will stick with this well after August 17th, or 18th, when the ballot measure is, calculated, but I don't know. I don't know the appetite of our municipalities and what their budgets look like to do something like this.
Commissioner
Mr. Chairman, also,
Duncan.
you talked about the 2 million and 1 million and 1 million.
Mhm.
Is that a cap?
It appears to be based on what we see. It is, but that is per year.
Okay. Because what I was getting at, what I was gonna get at is some counties do not have ambulances or hospitals. And our county is very large, land mass wise. So a lot of times we were able to get grants just because of that, because of the huge, vast amount of property we have to
Certainly.
so that's why I was asking, is there a cap? Because all the counties would not even apply because they don't have it.
Well, in talking to the Department of Health, they are very much looking for partnership and I wouldn't call it consolidation, but they're looking for deeper partnerships across ambulance services, whether it's operated by a hospital or a volunteer type of
Okay.
ambulance system. From my talking to Department of Health, they are really looking for entities to join together
Okay.
to do this. So even though they've allocated about 44 million, they are really figuring they're only going to get about 20 applications
Mhm.
based on the number of ambulance licenses available. So my hope is that there's more money available and there might be a second bite at the apple here.
Okay.
But I think we can't plan for that type of situation at this moment. I think
Okay.
we're kind of, I wouldn't say a step, but there's some money coming in. We just
Yeah.
need to make sure we're using it effectively.
Okay.
The other thing that as I look at what's available from, go ahead, sorry. I will approach, the board at River Peak Health. Because that board, that hospital has not been stood up yet, much less has an active, license. But we do have a very good partnership with Hot Springs Health, which is a municipal hospital.
Right.
We might try to see if we can use them as an arbiter for getting us additional funds.
Conduit.
Yes, so I will do my best on that to try to goose some more monies out of the critical access hospital part. But there's one other component here. Okay, so let's see. For them, most of their initiative is tied to labor and delivery, imaging, and then dialysis. So it might not necessarily put us over the top on anything, but they do have an additional 250,000 available for emergency rooms, and like there are a handful of things related to ambulance inside of the critical access hospital, but that's going to require a little bit additional coordination.
So
I'll do my best.
they call that a call, critical access hospital.
Right.
So we don't qualify for a critical access hospital because the hospitals are too close together.
And in addition, they're privately owned.
Yes. So, so that throws a wrench into that gear of the works, but, there's ways to work around. And with the help of, the folks at Dakota Regional Health, Ambulance Service, I think they'll lead us in the right direction.
Yeah.
And I know we're running along, but you all got a handout in your packet,
Correct.
but we have to act. I mean,
Today.
we have to act on the Joint Powers Board today.
Mm.
We have to, I will get a hold of the Department of Health and see what we need to do to get to apply for a license. And I don't think it'll be much of an issue since we've already had a license in the. But I will find that out. But all this stuff has to take place and we have to apply for a grant and we have to have all the municipalities join Joint Powers Board in order to make this all work. So Riverton's talking, it's on their agenda tonight, and I think Lander is next week.
I think that's accurate.
Yeah.
And what I might ask, Mr. Chairman, I don't know if you still have them, but we had given you, at the work session, we had generated 3 resolutions for kind of different directions. There were 2 that were germane. One was a joint powers board, but the other was a kind of using FCAG as an interim joint powers until one could be established specifically for ambulance. It may be worthwhile to utilize one of those as your guiding document for resolution as we get started. My recommendation would be to, just for administrative ease, using FCAG as your starting spot with the intention of eventually moving into a different joint powers. We have them electronically if you want.
Okay, if you can send them to Emma, that'd be great. And we'll go from there. And I don't want to keep you any longer than we have to. Any questions?
But, yeah, Mr. Chairman, but as far as keeping track of the money and all of that, wouldn't it be better to have it in the county, you already have it set up and you go, rather than trying to put together, have to add administrative, treasurer and that kind of stuff to keep it administratively up to date?
Without, in my limited understanding of FCAG's bookkeeping ability, I think both are well matched to handle those funds
Keep track of everything.
and make it available for public record.
Administrative.
Yeah, but
I have.
yes, okay.
Thanks, Mr. Chairman. Okay.
Thank you so much for your time. Is there, so I guess the only other thing that I might ask of the commission is, so this was endorsed by FCAG, but I might ask, as you're looking at the report as well as this model, obviously it's from any business plan, you're only as good as the first shot fired as far as how well it will work in the future. But if this is something that is amenable to the commission, I might ask for consideration of endorsement of this model going forward.
Okay. All right. Thank you for coming over. Thanks for and your help.
By the way, at the back of your packet, is the basically printouts of the model that we built that shows all of the assumptions as well as kind of how we got to the numbers that we got to.
Okay.
All right. And I told Kyle Butterfield that I would join the meeting tonight in Riverton if you want. So, and I'll make the same offer to Lander, Du Bois and Hudson as well. So, thank you for your time. Thanks for coming over and changing your schedule.
Yes, thank you. Okay. Okay, the next item up is U.S. Department of Agriculture Forest Service bid opening. Came up and then a PLM invitation to participation in proposed withdrawal of public national forest system land
from location and entry under the US mining laws for the conservation of the greater sage grouse.
So this is an invitation to be cooperators with the BLM on the greater sage grouse plan. And we always insist that we are cooperators.
Yeah.
So I think we need a motion to continue our partnership as a cooperator with the BLM, with the greater sage grouse.
Okay, so moved.
Yeah,
Further discussion. Been moved and seconded. Further discussion. All those in favor?
Aye.
all right,
Opposed? Motion passed.
Okay.
Sign that.
And then the next item is the monthly review from clerks of the and public health.
Good.
That's it.
All right. Right, public comment.
There was none.
Okay. Tim. What are our times on these?
9:45, 10, and 10:30.
Thank you, Mr. Chairman.
Yep.
Members of the county commission, on my notes here. But I thought after our discussion last week and some of the influences that brought some concerns forward, we might have a follow-up that would allow some clarifying points, some information that was requested. There we go. So, as always, stand open for any questions or comments. I'm sure there should be plenty. But I do think it's important to clarify the basis of WRTA's request, not just this body, but to everybody, for local financial participation, particularly because in recent discussions regarding the need for that support appears to have been influenced by some incomplete information. So respectfully, the conversation seems to have proceeded from the premise that the WRTA should operate in some form with profit or as private businesses or generate some sufficient revenue to sustain itself. I think I've mentioned multiple times before how complex public transportation funding is. And some of you I know have had to suffer through my very in-depth conversation or presentation, probably 50+ slides of exactly how it does function. So if I might call on you to recall some of that information as we walk through this, but that's simply not how public transportation funding is structured. Either in Fremont County or under the federal or state funding framework governing transportation systems. WRTA, as like our counterparts, is not private, profit-seeking enterprise. It is a public service established to provide mobility, where the private market can no longer do so affordably since 1963. With consistency and equitability, public transportation is intentionally funded through a combination of federal, state, local, and contractual revenue sources. Local subsidy is not evidence of any perceived financial failure. It is fundamental part of that model. I seem to have glossed over it, but I do want to make sure I did conduct an assessment of our ridership based on the comments we received last time of the county. Outside of any municipal boundaries, the ridership that constitutes those individuals is 44.5% of our demand response ridership. Those riders do not have pickup addresses, drop-off locations, or both that rest inside a city boundary. I can extrapolate upon that data as deeply as we feel comfortable. I can zone it. I can show exactly how many of those rides were performed in each one of your representative districts if you would like. I'm happy to provide whatever data or support materials you would find helpful. We do the same thing with the request from the municipality as well, with the emphasis that the request is not arbitrary, inflated, or based on a desire to shift responsibility. It is developed through a very deliberate methodology that considered service levels, ridership, operating costs, geographical coverage, and county residents. The amount requested was intended to reflect fairness, reason, and measurable operational reality. I also want to clarify a point of this in the discussion following my request last meeting. WRTA specifically was not requesting, its request was not limited to nor conditional upon any use of economic development fund. The request was for local financial participation in general. The specific funding source is ultimately a decision of the commission, and may include whichever funding source you find appropriate. From WRTA's perspective, the source is much less important than securing timely and dependable local commitments sufficient to preserve service. The commission certainly is able to decide whether it wishes to financially participate. However, the decisions should be made with a clear understanding of how public transportation is actually funded. And what the consequences of our reduced local participation might be. It should be based upon the assumption that WRTA cannot simply operate as a private company, generate any profit, or replace public investment through fares. As I believe is evident through our actions, WRTA has consistently worked to improve efficiency, reduce unnecessary costs, expanded service, and maximize every available federal and state dollar. We will continue to do so, and at the same time, there is a limit to how much service can be preserved when available funding declines and local participation does not exist. It has become apparent through the data and methodology supporting our request. There's some misinformation that needed clarification on how our system should operate. Our goal never has been confrontation. It is simply clarity and factual. The WRTA request is grounded in the actual costs, documented service needs, and realities of operating a rural public transit system of one few that is regional across the state, one of only two that are designated a regional public transit agency. I remain willing and absolutely available to provide the commission with any underlying calculations, service data, funding structure, methodology used to develop the request. And as always, and as I've emphasized, happy to sit down and explain through our calculations and how that was reached. But I definitely felt there was some need for some clarification after our last meeting. So if there's no questions, I'm
Any
happy to leave
questions?
it there.
Any questions? Okay,
The only thing, Mr. Chairman.
Yep.
The only thing is that you know, the federal government and the state government have brought in $2 million. Is that correct? That's what they're sending us to run the buses, right? About $2 million.
When you combine capital 5339 and 5311, our annual would be about 2 million. We did receive some reductions, so we're going to be sitting somewhere around 1.6 million. When you combine that with capital purchase or capital funds and operating funds, we did receive $240,000 reduction in our operating revenue. When you combine that with local match, it's about 380 total budget impact. 380,000.
Okay, so is that the amount of money that you'll need to keep running in? It's about that many dollars, $7,000.
So $380,000 is our operating plus our local match to that operating. I think it would be irresponsible to request that burden fall on the backs of Fremont County and the municipalities and the citizens within it. I feel that was an oversight that rests at the state level, that we need to work with them at the state level to figure out what we're going to do. As I've discussed with YDOT multiple times, I think some of the fundamental flaw began in the reporting requirements established upon some of the smaller agencies that didn't quite understand how NTD data should be reported. So from the federal government's perspective, when you're reviewing that financial information and the total cost of the operation appears to be 7.4 million, there's no justification to increase that operating funds to that state. When in fact, the total operating cost was 12.4 million, but was not reported properly. And so I feel like there's some learning experience going on right now of how we can report that information clearly. And obviously I'll attempt to convince the response. The ability to report directly to the FDA would be very convenient for us, given our capacity as an agency. But given our population of the county, we are federally required to be what's considered a subrecipient for 5311 funds through the state. So as we always are proactive, we've taken that as a challenge and reached out to our state partners, and we'll work to further knowledge on how it should be handled.
And what about the ambulance or you're servicing the senior citizens both now too?
Yeah,
Correct.
I mean, we've always served.
Do they help you a little bit financially or no?
So that's one of our contract obligations that we're working through right now. We have several directors, or I guess the director with Riverton Senior Center and their board that we're in conversation with of what would be appropriate and how we would structure that. Since this is the first year out of the gate, right? We don't want to be seen as necessarily greedy, because keep in mind the nature of our service is public. So we need to quantify that in a responsible number, and I believe we've done so.
And so the 15% that you're gonna get off of the 3/4 if it passes will really pick up slack of course.
Absolutely, and I think I might have glossed over that in here as well, but I think it's important to recognize too that it's not just WRTA. When we did those calculations, it was for every single public transit provider in the county, which included Du Bois High Country Senior Center, which include Child Development Services, which include Lander Senior Center, right?
Okay.
All of those entities
So
would
all of those will be included in that 15%.
absolutely. It was calculated as
3/4% that is gonna
Yes.
come up on the ballot.
yes, with consideration as well as the necessary capital improvement projects that would be required, right? It is never easy to have to come up with those local match funds, especially for smaller agencies. And so we did calculate that as well as what Lander Senior Center, what High Country Senior Center, what all of those agencies would need to desperately upgrade their aging fleet. So
Okay, that's good to know because I think the public needs to know that.
absolutely,
Okay.
yeah. Well, I think if you have any
It's not just for
recommendations,
just not for your buses.
no,
It's for everybody's buses.
absolutely,
Okay, great.
yeah, both capital and operating.
Okay, thank you, Mr. Chair.
Thank you, Tim.
Thank you.
Appreciate it. Steve.
Commissioners, good morning. Steve Allen, County Planning. Have a re-subdivision of an existing section of the Upper Little Warm Spring Creek subdivision. This is a plat that memorializes what had been done as a record of survey back in the nineties, which was done outside the permit process. So normally someone would come in and do a replat when they were redoing a part of the subdivision. This was done with a record of survey. It was done prior to the county having the ability to watch these kind of things going on routinely. The lot owners that are on this plat wish to memorialize this, so they actually have lots through the permit process, thereby acknowledging that they actually own lots within the subdivision, which seems to be a necessary component of being able to vote within the Upper Little Warm subdivision on their restricted subdivisions. This went before, as one might expect, it went before the planning commission and they voted to move it forward unanimously as it is already an existing. It's just recognizing something that already exists on the ground.
Questions? Yes.
Mr. Chairman, I move to approve the Upper Little Warm Springs Creek subdivision lots 89, 90, 91, 92, 93, and 94 re-subdivision as recommended by the Fremont County Planning Commission.
Second. Been moved and seconded. Further discussion? All those in favor?
Aye.
Opposed? Motion passed.
Commissioners.
Thanks, Steve.
The rest of the day.
Chance is not here.
It's right in the new. And it's been updated, to show current. It's.
The one we have was not updated.
This one has been most up. That is the most up to date.
Okay.
Kansas.
Chairman,
Yes.
you. Chairman, move to approve the annual compensation agreement with University of Wyoming with the amount of 26,652. Contribute to the 4-H extension employee salary and benefits for the 2026-2027 fiscal years.
Second, true.
Been moved and seconded. Further discussion? All those in favor?
Aye.
Opposed? Motion passed.
Thank you.
Mhm.
Sage,
Morning.
morning.
How are you guys?
Good, how are you? Somewhat.
They're hit or miss, but I know they're being worked on, so.
Before we go into the update, you want me to do the motion? This is for the contract. This is the
Oh, yeah.
yeah, okay. Move to approve the contract with Wyoming Department of Family Services effective July 1st, 2026 through June 30th, 2028, not to exceed $298,135 for juvenile treatment courts.
Second.
Been moved and seconded to approve the contract. Nathan, have you had a chance to review that contract?
And it's for youth services, not juvenile treatment court. Sorry.
I do believe I trucks for you there, dental services.
So this is the CJSD one. I brought you a copy if you hadn't been able to yet. You want it?
Yeah, let me know. They're okay. Give me 5 minutes.
Okay. We will put that motion on hold and Nathan reviews that. And then we'll act on that after we get the report.
Perfect. So for youth services, particularly the day reporting center, we do have a student that is still coming to attend classes 3 days a week for summer school purposes, just to catch them up to their grade level before school starts. She will be with us, I think, till the end of July. So that has been pretty beneficial in just allowing some credit recovery and getting her where she needs to be for this upcoming school year. My update on the youth services was that contract through the CJSB grant. For the month of June, youth services received 21 citations from our local law enforcement. 9 of those citations ranged from individuals 12 to 15 years old, and 18 of those citations were in the age range of 15 to 17-year-olds. This month, 6 of those citations were alcohol related, and the others were a mixture of theft, assaults, criminal entries. So we're staying pretty consistent month to month on the amount of citations that we're receiving. Regarding youth services, I was able to get in contact with the city of Lander and have been placed on their agenda for our financial requests and funding. That will be July 14th. So that's been kind of a chore to get on their agenda, but we were able to make that happen so that we can request the $35,000 for youth services that we do and request every year. Within treatment court, CAST has 12 active participants. We currently have 3 individuals that have absconded, and so we've got warrants out for them, and working with probation and parole and law enforcement to try and get them back in the program. We also have 8 clients who we are working with through their attorneys and their court process to get them into the program. Treatment courts as of today will be leaving for Casper as we're going to the Judicial Branch State Training Conference that takes place the rest of the week. I just realized that I did not finish my sentence on that, so. I did put the agenda of our training, so it kind of gives you guys an idea of what we are being trained on, what that looks like, how we can bring those things back to Fremont County and to our clients. The great thing with the judicial branch is while there is the national conference every year, they really work with All Rise, which is our national standard, to help and see like what is the national conference trying to bring to the nationals, but what can they bring at the state level for those who have opted not to go to nationals or budget-wise can't go to nationals. So it is really nice that the judicial branch tries to bring some of that to us at a local level. So we will be there for 2 days and working on a lot of different things and the importance of some of that data too. They're revamping our data system so that we can pull better reports, we can have better data to be able to not only show you as the commission, but we can look at our program too and utilize what's working, what's not working. How do we navigate moving forward on some of those things? And then the last update I have is the position that I had open for the therapist. I was able to fill after some interviews and second interviews. And so she will begin with next week.
Perfect. Good. Did you have a lot of applicants?
I had a couple, and we interviewed everybody that we got applicants for. There's an applicant who is still very interested that we did not select, that I'll probably be asking for a position through my opioid funding to get them on board once the county budget gets approved. So, I mean, the applicants that we did get were really good. So it was beneficial.
Questions?
Chairman,
Yes.
not a question, well, maybe it's a question and a comment. You know, in with the issue with the state, you know, there in this upcoming issue of deciding laws and voting, the issue of cannabis is going to come up again. It lost by six votes the last time it was brought up. But yet, they have no problem letting kratom
Yeah.
be sold on every street corner here in the county, in every county. And kratom is very dangerous, very dangerous. I deal with individuals that lose their mind on kratom, adults, let alone, youth. But yet kratom is sold like candy. And, but yet we have a debate in Cheyenne over marijuana, but yet kratom is, you see the sign right on Main Street Lander, it says kratom sold here. I have a very big problem with that. And at one point, we had all the governments within Fremont County agreeing that, at some point that we were gonna do something against kratom. But then that died out. But I feel to support this program and to support this director, we surely have to look at in this next coming 6 months. We need to look at the issue creatively. And also let the other governments know and the tribes know that there needs to be a stand against kratom. Sure, we're not willing to stand against alcohol. Sure, we're not willing to stand against anything else. But kratom is just sold openly, like I said, and you don't do anything about it. That is very, very dangerous. Very dangerous. So that's kind of a statement. But are you seeing that with your adults?
You know, I think we saw an uptick in some kratom use when it first was prevalent in Fremont County. I don't know that we've seen a whole lot of right now, but with that, I don't know specifically that our UA tests specifically test for it either. We have a 15 panel testing cup. And I know in our last conversation, Mr. Thomas, when we were talking about kratom, I still have yet to verify that our cups test for that. So I will put that on my list too, because I think it is a huge problem and it's concerning that you can buy it at a local gas station.
Right.
I've heard the reports from the coroner, you know, we've had
Right.
overdoses from kratom.
Yes.
And so, even in just some of my own research, you know, coming off of kratom is worse than coming off of heroin. And so it's very concerning that it's just at free will at any gas station, convenience store. So I will double check on our cups as well, because I don't know that specific data, or even if that's something that's been in our preview for a little bit. I am working on updating our policies and procedures. I started first with treatment courts. I was looking back at some information and realized that it had been almost since 2016 since some of them were updated. And so with that, I'm looking at a lot of those things of our internal policies, how are we executing our practices, and crosswalking them with the Wyoming state standards, the All Rise best practices, and merging them all together so that hopefully we are covering all of those bases and we are looking at all of those different angles. So.
Yep.
Good.
Okay, getting back to our motion to approve the contract. We have a motion to approve it and a second. Further discussion. All those in favor?
Aye.
Opposed? Motion passed.
Thank you.
Okay, thank you. Drive safe going to Casper.
Will do.
You going through Jeffrey City?
No.
I think most of the construction's done as far as,
Yeah, I think it is. I had a family member drive to Casper this morning and they said it was pretty easy going, so.
Good.
Yeah.
Hallelujah.
Yeah.
with that. One thing before we take a break.
Okay.
Um. Your thoughts on the joint powers board for the ambulance?
Yeah,
Yes.
Yes.
I believe we probably better have a motion.
Mr. Chairman, was there some resolution things that we could look at or not? How you gonna make this as to all of us that are presented before?
Well, I think if we agree or disagree to
Form.
participate in a joint powers board for the ambulance operation, we can define it with an MOU later.
Okay.
So, do I have a motion?
Motion made to, move forward with the joint powers board.
Been moved and seconded. Further discussion? All those in favor?
Aye.
Motion passed. Thank you. With that, we will take a break and come back at
Lordy.
10:30. What's that?
2:30.
Did I say 2:30?
It sounded like 2:30.
You better have.
Long break.
Oh, gosh, no.
Order. Let's talk about, we're gonna accept the fiscal year 2027 budget. Julie, Jim.
Okay.
Thank you, Mr. Chairman, Commissioners. Julie Reese Clerk and Jim Anderson Treasurer. We've been going through the stuff prior to the budget advertisement, and then we always go back over through everything again and again and again, which is always a good thing. So in front of you, you do have a copy of the budget that we advertised. There is a section in there that I'm running. People from the summer. So it's the new one. I'll forward that to them. So,
Then get one for yourself.
yeah. You have one, it just isn't the stuff in the middle. So I did advertise a little bit different this year, just as we all do, we work with across the state with our other associations, and we've been advertising just the top level, which we can do, which just says how much your general fund is, and you can call me and ask for each individual budget. We have been posting those on the website, but in an effort to show exactly what each one of those departments were getting, I did do the whole first page for our advertisement this year, just so you know. So anyways, what we had there is what we knew at the time. So just to recap some things since we have advertised. And underneath that list that I have is then what we have made adjustments to, and that's why it's yellow, so we can keep track of. Now this is the newer one. Some things we have done, some things we still need to have you just decide. The fund balance has been adjusted. So what we did is we looked back, we had a report the other day of how everybody has spent and how the payroll went, and that's always real helpful for us. And we, as I mentioned last night, the public hearing, you should commend your departments for doing a really good job this year. We had good money coming back, and I know that wasn't because they didn't need that stuff. I think a lot of it still has to do with how much rotation of people going in and out of here, to be quite honest with you. But they were, I mean, we literally did not have that many people looking to be over budget this year or even close. We did forget the ambulance though. So that's kind of a really big number we need to put in there, and how much that carryover is or is not. And so that made it look not great as we were looking, but then we also knew last week that we'd received more in tilt. So we added that 1 million back in, and we're kind of back to where we were. We did update all departments, and again, like I said, they have underspent in most cases. Added all the SOC adjustments that you have approved. We updated the JTC budget as presented by the director to reduce that down to a half-time person. We added the predatory animal for $10,000 as approved. And we used the third year of mineral stabilization cash as a reminder to the public. The mineral industry was allowed 11 years to pay back their severance tax, which tax is it?
It was actually 13 years, to pay back, the year and a half's worth of property taxes that were deferred for the, mineral ad valorem. When it switched from being the traditional once a year tax bill to paying monthly off of current production.
So we got a real large influx of revenue. So at that time, a couple of years ago, we put in a mineral stabilization fund just to use that every year, like you would have received that money in the year that they would have paid it. So that's 685,000 that we put in there. We left the SOC of 300,000 again in there. And again, I'm going to remind you, we've hardly used any of it throughout the year. So it's really considered, you know, in your cash that you have, but, just wanted you to know that's still there. I left in the 65,000 for cap revolving payments. We'll talk about that here in a minute. I added back in 14,000 to the clerk for the true comp system. And just so you know, Emma and I have already met with them, and she is starting to send all the information they need. to the company. We hope 6 to 8 weeks to have some information out to you on, how that looks. As a reminder for me, they look at across the nation. We want to make sure they're looking across the state, but I forgot, they had asked me, who do you want to be, who do you really want to make sure where you're looking at? So I'm pretty sure there were several counties that I didn't pick, like Teton County and those that have way more money than we are, or little tiny counties that really weren't like us. So I picked, I'm sure, like 6 counties, and I'll review that again because we can always add them back in. But we also, I picked Lander and Riverton City, and then also school districts, and I'm sure those are Lander and Riverton as well. So we can add when we want, any time to do that, and they go out and get that information for us. So we hope to have, I think the biggest, so what I did also know about that one, and it doesn't seem to be that hard for us to get to them, is how much they're compensated too. So like, how much does the county pay for health insurance? How much does the county pay on your retirement? And so those numbers will also factor in. So when we're talking to our employees or to the public about how much they're getting paid, that compensation piece is going to be in there as well. We added some encumbrances. So the clerk and the election have some projects that were not completed in this year. So we had to encumber them, meaning we had to put what's left over in that project back in our budget so we can spend it next year. And so we did those, and then the clerk and the treasurer got updates in 2 areas. Cassell gave us an update finally. We've been digging for that, how much it was. We were off a little bit on the state, less than $1,000, but we adjusted it to what the real expense is going to be. JD Powers is a requirement by statute that the county clerk or the treasurer has to determine MSRP on all of the out-of-state vehicles that come in here. It's a requirement. We have to do that. They have now changed that instead of allowing them to use a couple of licenses and just share them, we have to have one for each person. And for us to have to do that by going from one desk to another, you're putting in the VIN. And so if you're at your own desk, you can copy the VIN. You can do the NMVIDIS report, which tells you where it's located in another state, and also what that MSRP is just by copying and moving it. Otherwise, you have to go to somebody else's computer and type it in. So it's important for me, for them, as many as I don't have over there, for them to have their own. Jim does also help us out by having them in his department. So when people call and go, hey, I've got this, and what's the estimate? They can look it up and say, okay, this is the estimate for your plates. And it kind of bypasses the back and forth for our customers. So we did add that back in. Again, not totally significant, $2,000 to $3,000, I think, each for us. So we added the $95,000 to the ISS budget for the items you approved last meeting. Have revolving, it looks like I have received all of the things I'm going to receive. And I was going to just check with the chairman of those committees and see if they want to meet maybe after the meeting next Tuesday. We would be ready probably by then.
Good.
Circuit courts, I had thrown their budgets out to them. They're very tiny, but they were just at a smidge down on theirs. So those are new and updated in the new budget. And I forgot on yours, the retirement. So we do need to discuss again. I know you've kind of given me an idea what you would like to do. I have gone through and reran that last night because we had a couple more SOC adjustments. So I wanted to get a closer idea on that. And so that number is 300. So for 5% for the employees to pay on both the law enforcement side and the public employee side. And a reminder, law enforcement changed last year and we just kept it the way it was last year. This year would move it down for the law enforcement by a couple percentage points. And this is the first year of the public employees. So that is $356,427. Okay, so that is something I know you've kind of indicated you wanted to do that, but I wanted to make sure that's where you want to go today. So we'll need a motion on that. If you want to make that change, I specifically have to have a motion on that one. And then
5% retirement employee
contribution. And again, you are now you're still the second highest in the state. I think Sheridan went above us. last year, and it looks like they stayed there this year. I will say most counties, just for the record, don't make them pay their health insurance or this. And, a lot of us here at this table are on the health insurance committee. And we've talked about retirement back in the day when it was really rough as to whether or not you're gonna lay people off or take furlough days or whatever, and our county employees voted that that is their money. They understand that, and they'll end up getting it. So I think skin in the game is a good thing, that they know what it costs for their, and I think this new program will be also really awesome, that we can probably make sure employees get to see that on a regular basis of what the county does pay for them. I know you can't eat benefits, but they are super important when you want to leave here.
That's right.
So-
They will.
Yeah, so, anyway, so that is, the one we have.
So,
So, go ahead.
employee contribution, retirement and contributions. We talked about the 5%. Is that what you want to go with?
Yes, I did.
5%.
Okay, then I need a motion.
Mr. Chairman, I move that we, set our, retirement at 5%.
The employee contributions.
I'll second, Mr. Chair.
It's been moved and seconded. Further discussion. All those in favor?
Aye.
Opposed? Motion passed.
Okay. The next thing we did for, we've been talking about is, Commissioner Ellen had been wanting to do something for everybody who maybe didn't get $3,000. It started at 5, we know that's a lot of money, but we can always go look at that too. Oh, and so just so you know where you're at with the budget, there's a million, where is it? Make one with the yellow. 1,650,000 before you did the retirement, so you've got about 1,300,000 or a little bit less than that. Okay. You see at the bottom there, right before my name, it's in parentheses. I'm the one that's yellow, yep, 1,650,101.
Yes.
And so by doing this, it takes it down to about 1.3, a little bit under 1.3.
Julie, that pilt was higher than what it was last year.
I'm sorry.
The pilt is higher than.
Yes, and we added that,
Last year.
and we added that.
Okay. That's a little bit higher. Like a lot.
Yeah, it was
It's quite a bit higher. It's about $1 million more than what we had.
That's what I saw, because it was like, I was falling pennies in the taxes.
Yeah.
Yeah, so what?
So we added that in, yes.
Okay,
Okay, so then I gave you the copies of, all the employees, and this came right out of Gravity. So so there might be some areas that say vacants, and again, this is just totally rough. Whatever you decide to do here, we would, I'll have some questions of how you want to, move forward on any kind of something for everybody else. So looking here, the first page, this is sorted by how much they received in this last fiscal year. Some of them have moved to new jobs, but then they also got SLC adjustments recently. So again, when the new program comes out, again, we will hopefully be able to see where they are on the scale. So when they come and ask you for, SLC adjustments, you'll have an idea. When they've been here, hopefully years of service, anyway, those kind of things, we hope we have that information for you. So basically, nobody on the first page would qualify for any kind of funds. I always put 0 on all elected officials and deputies, because that is coming in January. And then also all of your department heads, you usually decide what that number is, so I didn't let them have any either. Then there's some new folks in here, and I didn't. Well, like one I gave, I guess, the amount to, and one I didn't. So, I mean, that's what I said. You might want to say no or yes or whatever. Starting on the next page, you can see what the difference is from their SLC adjustments compared to the last page to the people that didn't get any at all. Then at the very bottom, I gave you a narrative here that most employees are included, no department heads or offline directors, as those also get usually set up somewhere else. But if you would probably have to give money for those as well, just on the offline board side of things. Some questions on new people and some that are grant funded. We have found that we generally don't give your increases to grant funded folks, because they then have turned around and usually given increases on top of ours. So we generally you kind of stay away from that unless they're not getting anything from the grants. Um. Okay, and then you'll see over on the right-hand side that, if you were going to give 3,000, up to 3,000 for anybody who didn't receive that, then the dollar amount is, 195,171. And the benefits on top of that is $44,050 for $239,221. But then I needed the offline boards, which they're not listed on here because I'm positive none of them. And I know they've come in and replaced people, but I do not remember them being here for any SOC. So I just went to their list and that's 84,868 in offlines. And then, and that includes their benefits on top of that. So that would give you $324,089 if this is the route you'd want to go. And again, this is that's why it might not be exactly that, because some people are part-time. I don't know how many hours they are, so you would have to adjust that and rate those out and whatnot. So anyways, with that said, also just to give you an idea, let's say, I know there's been some discussion on how's that gonna affect, if you did this, how is that gonna affect SOCs? Maybe we finally got, Jim and I talked about it, so let's just use our department. So we finally made some adjustments and some of them, we wanted them at this level, but then they're under 3,000, so we give them more and now they're up against somebody else. So just some of that conversation. So I also thought too, well, what if you wanted to give a COLA, which could go to each department, but you could have rules, I don't know. I'm just trying to think for you. So I took the total amount of how much money we're spending on salaries. I think this is, let's see what I was looking for, 2%. So it's 12,147,115 is in salaries. Again, now that is going to include elected officials and whatnot, so you know that's not the right number, because I just did it fast, so those would come out. But if you did like a 2% COLA, it would be, and I don't have the benefits on top of this, but 243,000 plus benefits. If you did a 3%, it would be 365,000 plus benefits. And if you did a 3.5%, I've heard 3.5 a lot this year in COLAs, that would be 425,000 plus benefits.
And would that be for the employees that did not receive an SOC adjustment?
So usually COLAs are supposed to go to everybody. Now, what we have done is taken that, however many their employees there are, divided that and said it's this number, and then we say, okay, in the clerk's office, there's 13 people, you can give out this much. And you've let us, it might be listed like a COLA, but then you let us adjust that. Or, I mean, you can make whatever determinations, you can hold this money and we can wait till, not wait a long time into the next fiscal year, but we could wait into the fiscal year.
So like I said last week, I think I've rethought this. And since you've just gotten started with the True Comp services, I would like to look at what they find. And then we can go back and say, okay,
this is what we want to do. Right?
Donald Trump is making, I mean, you know, he's not making, he's making $2,000 less, or
look at the percentages in our,
yeah,
like, so many are making 25. We've done that before too, where everybody's meeting 25%, but this group,
yeah,
and maybe you want to, and
yeah,
I mean, and I'm not saying that the other folks shouldn't, but review this, because you will see that some administrator positions are getting it. And again, we're back to, and I'm not saying that they don't deserve it. I mean, I have those on my level too. But I think we keep hearing everybody, yes, I've heard us all say we'd like to get to 25%, but that doesn't mean you come in and ask for 25%. But so I think it will be interesting what we get, and it won't be like these folks will have to wait very long. And number one, their health insurance did not increase that much. That's gonna hurt them because the retirement is going to help every single employee have money in their pocket. For an example, a $46,000 person, because I was talking to that person, is giving them another, and it doesn't sound like a lot, but $500 a year in your pocket, depending on your taxes, you know.
Stuff lot.
So it's not like you are going in the hole for anything that we're doing this year. I mean, and I know there's some departments who have said, well, if they don't do this, I was hoping to get whatever the commissioners gave. And I think if we don't wait all year long, and as soon as we get true comp stuff back to you, so we can kind of make a plan, that would probably be, I think conversations with your department heads and elected officials would be really good on this.
I think my personal thought is that we wait till we get the true comp information back. You said it might be 6 to 8 weeks.
Depends on how fast we can get stuff to it, and I see Emma's already started, so.
And we can look at those numbers that they provide us and see where we're at. And then we can have our discussion about our department heads and, you know, about adjusting that as well. And I think that information will come back to us too. Correct?
Yeah, I mean, it's all based on, so here's, if there's any hangups, here's where they are. If you don't have job descriptions, hang up. If you don't have what they are working as, and we have those, groups that say, I'm gonna use Emma now as an example. So she's got like admin, but she's starting HR, so she's kind of half and half. You can put those in there and that didn't act like it was a big deal to them. So some of those folks, I need to go back to them and go, okay, kind of give me, and they don't even say that the percentages mean a lot, but to me, I still think that giving us the percentages will help. Like mechanics and custodians and groundskeepers and stuff like that. Okay, what's the percentage do you do of those things? And I think that will help them come up with this munched up thing of what we've been trying to look for. So those are the things that will hold you up is if we don't have job descriptions and good job titles for those folks. I think we're okay, but I mean, we'll look at those as we go.
That might need adjustment.
Well, and then the new employees that have just started, you know, we don't have a probation period, but it would give them a chance to also prove themselves, if you will, that they're gonna stick with the job and they're you know, they're a good employee, so on and so forth. In that 6 to 8 weeks, and then that department head can come to us either way. We can look at the numbers that True Comp gives us and make adjustments there, or the department head can come to us, or the elected official can say, okay, this person has really proved themselves, they're an asset to our office. We want to make an SOC, I'd like to make an SOC adjustment. So we could do it several ways. One with True Comp recommendations or their numbers, or we could do an SOC adjustment. Because we put money back in the SOCs again to keep that, and I think that's something we need to do every year. But we have 2 ways to do that, and we're not excluding the new employees. We're just giving them a chance to learn their job, and that's my thought. What's your thought?
Well, we do have a number of them that, we do have to review in the sense of the COLA. And then that, just helps. And so, yes, I agree in the sense of review, going back, but then waiting for that. As stated, but, we do really need to make sure that we don't wait too long.
Right.
Especially that's what happened to the dispatch. You know, that shouldn't happen, but it did, so we shouldn't wait too long to make sure everybody ends up seeing what we're gonna do with this. And then there's individual programs that, like you said, didn't show up. So we really have to look at, see what they're at.
So, are you for waiting until we get true comp, information?
How long is that?
6 to 8 weeks.
8 weeks, yeah.
It seems a long time.
So I
Yeah.
assume then we have a meeting again next week
Right.
with them already, and I know Tim was already sending stuff to them.
I don't mind waiting just for them, but it seems, Chairman, it seems a long time. To get
Well,
things going.
I guess my thought is, if they're a new employee especially, it's not such a long time to wait for an increase in pay. I mean,
Yeah.
But
And again, I'm not saying, I mean, I've given you numbers of all kinds of stuff. You
Right.
can certainly do whatever you want today, you know, to fix things. It'll take us a second to get your final budget, because we'll have to get everybody changed over and payroll stuff done for July. And then because I have to know exact numbers to set your budgets, but well, we can do that. I mean,
Yeah.
we've done it before.
My only concerns is I don't want to get conflict again, like we had people that was making more money that shouldn't have been. I mean, it was all over the place. And I want to we work really hard to make sure that our employees are all equally taken care of.
Right.
And that I don't want to throw a wrench into the spoken. So if we was, I don't want anybody to look out of the loop. So I think, has everybody been looked at?
So,
Did we pass?
so I know the sheriff specifically said, well, I didn't do anything for dispatch, and we're talking, he did do some for his admin folks in that area, so it wasn't like all of dispatch.
Right,
And I'm only speaking for him just because I remember him saying that. So, but nothing stops him from coming in next week and doing an SOC adjustment.
right. So
So-
that's where I'm at too, cause I don't mind the true comp things that, this is great, I think it'll help.
Absolutely.
A good tool. So, but I don't want it to get messed up right now, where we're uneven with where we need to be, and I don't want to mess up the levels that everybody has worked to set in their departments. They work up to a level, you get an SOC, work up to the next level, you get the SOC. It's very important in many of our positions within, so. The COLA is always, I think it should be in the hands of the department head.
Yeah.
To know they know where their people are more than anybody. They've set their goals for those people, they've got to meet those to get the COLA. So, I always liked that. I don't wanna mess up any SOC, so we've got right now, or how we worked to get everybody on board where we're at. Cause we do need to bring this up, and you're right. We're clearance, I don't wanna wait too long on this.
And that's what I'm saying, if you do our COLA, generally that's for everybody.
Yeah.
And we've done this before too, where again, we don't like the percentages, because the higher get higher and the lower
Right,
they'll stay low,
right.
but you can, let's say that number for that number here is $2,000 per person. We can just do
Adjust.
that in our office and
Yeah.
not allow the departments to monkey with that. And what that does is it raises the whole base.
Mhm.
Can do that. You can do that, but that means everybody
Yeah.
that's on this list, well, except for, again, the elected officials and
Right,
and even the department heads would get it in this case, and then you could still do your SOC adjustments for them. I'm just saying that is one way not to monkey with the SOC, so to speak, is if you're doing this. And where we are not in the 25 percentile as a majority, I don't think that hurts anything. So that is an option you can do, and then you just don't allow the departments to. Yeah, just do it. Figure out a number.
Commissioner.
I'd rather just go with the SOC, Mr. Chair. That way you can see the work history first. I think that's the way to go with it. And, you know, if like you say, if there's any adjustments that need to be done, if we find somebody that's super talented and they need an adjustment, they come in, we give them the adjustment.
Mhm.
Let's just, That way we can kind of see where we're at. We don't have to make a quick decision here on that. So we got a little bit of background.
Yes,
We do need to at least put out the word to elected officials, department heads who are in charge of department, or those who are individually in charge of a program, to come to the table and look for those adjustments for their employees. I don't mind waiting for, I just said wait, but then I do believe they need to come table and ask for at least an SOC for the people, if they haven't done it yet.
well, I mean, we have two tools. We have the department head or whoever, their boss coming in and asking us for an SOC adjustment. And then we now have the true comp that will say if we have, and then somebody comes in and says, oh, I want this SOC adjustment. And if you take a look at this list, there are several that have gotten huge SOC adjustments in
Yeah.
the last year.
And they
And
don't.
anyway,
Well, and the true comp will be a tool for all of that.
right,
So I think when you, on the true comp, the people who have access to it could actually change things.
Yeah.
I'm gonna allow you all to have access to it, it's just asking you not to change things. They don't have like just a view only right now. But when you have folks coming in, you're able to go in and go, what are admins going for? We did that last week, you know, what are all the admins in our county looking like? What are all of these looking like? So that you can compare that. And it will be helpful, I think, at the table where right now we kind of struggle with that. We're going off of what we give you as department heads of what we have found. And so I think this will help us move into a policy for how you're gonna do SOCs, how you're gonna do adjustments in the future. Cause we're getting there, but we're still pretty wonky in how we do it. Not everybody's doing it the same. So I think we're getting closer to maybe having the tools to put a policy together that says you can only do X, or once you get to 50, you might be stuck there like Larry was for several in his job. Maybe you're stuck there if we can't get more people to get up to a certain level, but.
so you're willing to wait for, I mean, we don't have to wait forever. We still have the 300,000 if we approve the budget. We still have the 300,000 for SOC adjustment.
Right.
And we can make other adjustments, other funding. If, I mean, an emergency or whatever, before we get to true comp. But I think we need to utilize the tools that we have now in place and see how they go from there. And if not, we can say, oh, this is not gonna work, let's do something different. So you willing to wait?
Yeah.
Willing to wait?
Sure.
Willing to wait.
Yes.
So, Mr. Chairman, is there any other items? So we've already got the retirement that I will redo, and put their new numbers in here. So is there, so you've got that, losing the page. The 1,000,006, so it'll be now a little bit less than 1,000,003. Then we're just gonna roll that into, to our cash reserve. Whatever you need
Yeah.
over the year. And we already had 1,000,000 in there, so we did have, extra from last year.
Yeah.
So I think we're in a good shape for what it looks like or not know what it looks like for next year. But I think we're in good shape having a couple million plus in there. So, Jim, did we have anything else we have to think about today that we?
I don't think so. Well, you mentioned the capital revolving and having some reserve in there for additional rental payments through the year. So I think if we keep that with the 65,000 in there, I think we could pretty easily, I had just haven't done it yet, taken a look at the amount of requests that we have, and of course, that doesn't necessarily guarantee that those would all be authorized, but you know, we could maybe gauge as to what those rental payments may be. So I think that we're in good shape with that, as far as having that in the reserves, and then, of course, as things are authorized, then we'll dole out that 65,000 to the appropriate departments.
Anything else? Jim?
Budget, knowing that, we'll move that, if you guys can adopt it, that'd be awesome.
Okay. Commissioners?
Chairman, move to approve resolution 2026-19, appropriation resolution to adopt the Fremont County budget as submitted without alterations or revisions and as attached for fiscal year 2026-2027, beginning on July 1st, 2026 and ending June 30th, 2027. And that the expenditures of each office or department or spending agency be limited to the amount therein appropriated.
Second.
Been moved and seconded. Further discussion? All those in favor? Opposed? Motion passed. What about the E911 budget?
Oh, yes. That's the other part of it. Mr. Chairman, as mentioned last night, law allows 75 cents per line, for the E911. As you can see, last year, their budget was $437,390. That was our estimate. Projected final, we believe, was $341. And so projected next year, $337 and 860, I was to say cents, 387,880, well, 337,852 is what we
Are you
expect.
sure?
I'm not sure. My eyes are like flashing at me, I'm like, what does that say?
8,000.
Yeah, basically. Jim likes big numbers. So.
Okay.
Anyway, so anyway, that's the max you can do if you would like to do
Okay.
75 cents.
If you so choose, commissioners, need a motion to approve the E911 budget.
So moved.
Second.
Moved and seconded to approve the E911 budget at $338,000 from cell phone revenues. That's the max, that to charge the max is 75 cents.
75 cents per line, and it's not just cell phone.
It's not a result. I thought,
Yeah.
Yeah,
yeah,
so it's all lines of service within Fremont County.
okay. Further discussion? All those in favor?
Aye.
Opposed? Motion passed.
Now,
Okay, that's it. Recap. Sorry. Commissioners, anything else?
Nada.
To adjourn.
Second.
Been moved and seconded. All those in favor?
Aye.
Opposed?
And you put that in there fast.
Yeah, first time in how many months we